Childhood, adolescent, and young adult cancer can have a lasting impact on survivors and their families. While the focus is often on physical health, it's important to also prioritize mental health in survivorship. Mental health means more than the absence of mental disorders. It exists on a complex continuum which is experienced differently from one person to another. It's normal to feel a range of emotions during and after cancer treatment, including anxiety, depression, and fear. Your emotions deserve just as much attention as your physical well-being. Acknowledge these emotions and seek support when needed. Having a support system can provide emotional and practical support during survivorship. This can include family, friends, or support groups. It is important to find out exactly who can support you and give you strength. Not everyone can do this without being affected themselves.
Sometimes it's people you don't think about at first who help you the most. It might be neighbors, a friend of you, the family or classmates or colleagues. If you know who can support you best, ask these people directly and actively to help.
Professionals can help you to find out what is going on, to understand things better, and to develop the confidence to cope with difficulties. It can be about differentiating between healthy processing and emotional disorders, for example, between grief and depression, or about processing what you have experienced, or about acquiring skills and competences. Above all, however, it is about helping you to find the right individual support options.
For psychosocial support, you can choose from many options. Sometimes it feels good to talk about your worries, but sometimes it's better to do, for example, art therapy or sports therapy, or sometimes it's about neuropsychological intervention, for example, memory training. The most important thing is that you choose what feels right for you and how to proceed.
It is important to get in touch with healthcare professionals about your mental health and any concerns you may have. If possible, involve professionals from different disciplines to support interdisciplinary communication. Now that you know what your support system is and what professionals can do for you, you should also know what you can do for yourself. Taking care of your physical health through exercise, healthy eating, and sleep can improve mental health outcomes. Also, relaxation exercises such as meditation and breathing exercises can reduce stress and improve emotional well-being. Learning about mental health and survivorship can reduce stigma and increase access to resources. Education can help to increase self-control and reduce anxiety. Moreover, it is helpful to stay connected with others. Social activities and hobbies can improve support and reduce isolation. Mental health is not just important during and shortly after cancer. It is a constant companion on your journey through life, today, tomorrow, and in the years to come. Even after several years, new challenges can arise. Despair and hope can alternate, and that's okay. You don't always have to think positively, but it's important to continue to look after yourself. Don't be afraid to speak up and advocate for your mental health needs. Mental health is a human right, so don't stop fighting for it like you do for your physical health. You are entitled to easy access to care. To make sure you don't forget anything, the key points are summarized here, and you can find more information on our website, beatcancer.eu. Try to follow the recommendations as good as possible and be patient with yourself.